Hey, and welcome back. This is Dr. Dave. Thanks for tuning in. A quick quotation to get us started. These words from Sir William Osler, felt by many to be the father of modern Western allopathic medicine. So Wild Bill says, and I quote, "The person who, upon awakening, feels that life is a bore or a burden has been neglecting his or her machine, driving it too hard, stoking the engines too much, or not cleaning out the ashes and the clinkers." As eloquent as that is, what does it really mean for us these days? And if you're like most of your fellow humanoids, mere mortals, that could show up roughly as follows: fatigue, sluggishness, anxiousness, irritability, lability, reactivity, irascibility, right? You might have low mood, you might have poor concentration, low energy, lack of motivation, sleep difficulties, both falling asleep and staying asleep, but also sleepy during the day. Might even predispose you, put you at greater risk for infections. Who wants that these days? Other illnesses. And then certainly you got those focus, concentration, attention issues, right? So this is the kind of lethargy, fatigue, brain fog, no joy in Mudville, eating all the time, sleeping all the time, except at night when you're trying to sleep. All of that just speaks volumes to the likelihood that your adrenals are wearing out, all right? Now, I know that mainstream psychiatry, mainstream medicine takes a dim view of the concept of adrenal fatigue, adrenal exhaustion, adrenal dysfunction at this level. I happen to be one of those that firmly believes in it because I measure your cortisol levels all of the time. That's actually one of the best biomarkers in all of psychiatry. Salivary cortisol 4 times throughout the day gives me the area under the curve and the slope of the line. And all of that tells me what your adrenals are doing. And if you have these symptoms and you've been neglecting your machine, then you probably have some stage of adrenal exhaustion. The good news, with time and conscious, deliberate effort, you can resuscitate those poor adrenals. Okay, how might you do that? Well, that would have to do with lifestyle. Get your 8 hours of sleep. Watch your diet, never let your blood sugar spike. Some of the same things we talked about before to prevent chronic degenerative inflammatory-based diseases. Same is true for adrenal dysfunction. In addition to that, I use a lot of supplements. There's no medication I could use for these symptoms. And that might look like pretty high dose vitamin C, certainly vitamin D3, adrenal-specific vitamins and minerals that would include but not be limited to calcium, magnesium, copper, manganese. Now, I will also use what we call herbal adaptogens. These are just plain old herbs, botanicals that include often things like maca, things like ashwagandha is one of my favorites, rhodiola, eleuthero. There are a lot of good ones out there. I usually combine them in a dropper. And take them twice a day with my other supplements. In addition to that, if it's really severe, I might give you what's called a glandular, an extract from an animal's adrenal cortex. Usually I use pig porcine, and these are all products that I use myself, especially when I'm on the road and traveling, especially during times of increased risk for infection, flu season, for example. And then lastly, if you need a bridge, then I might even prescribe you some low-dose cortisol-based medication or supplement, right? So it's a pyramid-based program, lifestyle, but then also some adrenal-specific supplements to help resurrect, pump new life into, resuscitate those tired and failing adrenals. All right. Do it all the time. It's very important. You do not want to let your adrenals go. I'm amazed at how many youngins I see. I mean, people in their teens, 20s, 30s, 40s. No reason for their adrenals to be burned out yet. But they are. So if you think you got it, let me help you check. And then I'll be glad to give you my opinion as to how to fix it. All right. I think that's all for today. Dr. Dave signing out. In the meantime, be safe and stay sane. Peace out. All right, thanks.